The paper Radiations as Environmental Hazard and Disaster in Cancer Pathogenesis has been presented by Professor Dr. Govind Pandey in National Seminar on Environmental Hazards and Disasters of Hawag Women's College, Jabalpur, held on January 12, 2009. Introduction. Radiation is emission of energy from any source. There is hardly any aspect of human welfare in which nuclear radiation does not play important role. Radiation is used for scientific purposes, medical reasons, and for power and energy generation. High frequency radiations, ionizing, and ultraviolet radiations may cause genetic damage leading to cancer. Radiant energy, whether in form of ultraviolet rays of sunlight or as ionizing electromagnetic and particulate radiation induced neoplasm, that is cancer in humans and experimental animals. Effects of radiations. Generally, body health is affected on the basis of amount and duration of radiation exposure. Health can be reduced or death may occur due to exposure of radiations in some of the following ways. Stochastic health effects associated with long-term low-level chronic exposure to radiation. Non-stochastic health effects appear due to high levels of radiation exposure and become more severe as exposure increases. Short-term high-level exposure or acute exposure. Many non-cancerous health effects of radiations are non-stochastic. Other long-term health effects other than cancer, most prominent long-term health effects are mutations which can be teratogenic or genetic. Teratogenic mutations are caused by exposure of fetus in uterus that affect only individual who was exposed. They can include a smaller head or brain size, poorly formed eyes, abnormally slow growth, and mental retardation. Genetic mutations are those that can be passed from parent to child of that is offspring. Cancer pathogenesis by various radiations. Childhood leukemia was early connected to power frequent magnetic fields of radiation already in pioneering work of Wertheimer and Leeper 1979. Scandinavian scientists have identified an increased risk of malignant brain tumors, for example, astrocytoma and meningioma. Hardelet et al. 2005, Lone et al. 2004. A clear association between adult cancers and FM radio broadcasting radiation was noticed both in time and location. Hallberg and Johansson 2005 breast cancer. Benny S. Willie et al. 2005 was developed in elderly women by a much more extensive use of personal computers more than 3 hours per day, mobile sets more than 3 hours per day, and other household electrical appliances. Among elderly women who developed breast cancer in first time, 20% were regularly exposed to power frequent fields. In more modern period, 51% were so exposed mainly through use of personal computers. Significant influence of electromagnetic fields was seen in formation of epithelial breast tumors. Hallberg and Johansson 2005 stated that there is a strong association between body resonant non-ionizing FM radio and existence of malignant melanoma of skin. Since this frequency range has a penetration depth of about 10 centimeter into human body, it is suspicious that resonant current may affect immune defense system also when it comes to beating cancer cells in lung. There is no safe level of ionizing radiation. Even exposure to background radiation causes some cancers. Additional exposures cause additional risks. Hazards of exposure to some radiations were recognized after discovery of X-ray in 1895. Skin reactions were observed in many people working with early X-ray generators, and by 1902, the first radiation caused cancer was reported in a skin sore. Within a few years, a large number of such skin cancers were seen. First report of leukemia, a type of cancer that arises in bone marrow in radiation workers, appeared in 1911. Marie Curie, the discoverer of radium, and her daughter are believed to have died of radiation caused leukemia. Since that time, many studies confirm cancer causing effects of some types of radiation. Electromagnetic, that is, X rays and gamma rays, and particulate alpha and beta particles, protons and neutrons radiations are all carcinogenic. Marked increase in incidence of thyroid cancer also seen in areas exposed to fallout from nuclear power plant accident in Chernobyl in 1986, Williams 2003. Sun is a major source of UV radiation. Cleaver and Crowley 2002 reported that there is ample evidence from epidemiologic studies that UV rays derived from sun induce an increased incidence of basal cell and cell carcinomas, that is most common squamous types of skin cancer, and possibly malignant melanoma of skin. Kumar et al. 2006 stated that UV rays have number of effects on cells: inhibition of cell division, inactivation of enzymes, induction of mutation, and insufficient dose cell death. Many pioneers developed skin cancers by X-ray. Miners of radioactive elements in Central Europe and Rocky Mountain region of USA have 10 times increased incidence of lung cancers. Most telling is a follow-up of survivors of atomic bombs dropped on Hiroshima and Nagasaki. Initially, there was a marked increase in leukemias, mainly acute and chronic myelocytic leukemia, after an average latent period of about 7 years. Then many solid tumors of breast, colon, thyroid, and lung increased with longer latent periods. In humans, there is a hierarchy of vulnerability of different tissues to radiation induced cancers. Most frequent are the leukemias except chronic lymphocytic leukemia. An increased risk of breast cancer has become apparent decades later among women exposed during childhood to atomic bomb. Preston et al. 2002. Treatment of Hodgkin disease, a type of lymphoma, delivers lower radiation doses to many body areas. Each areas include large amounts of normal tissues. Such patients are at an increased risk for developing second primary tumors. Ionizing radiation therapy is an effective way to treat certain cancers. During this, high doses of ionizing radiation are directed at cancer, resulting in cancer cell death. However, this can lead to DNA mutations in cells that survive radiation, which can lead to development of another cancer called second primary cancer. An increase in second primary cancer in area being eradicated has been observed in patients with several types of cancer following radiation therapy and or chemotherapy. However, some combinations of radiation therapy and chemotherapy are more risky than others. Children treated with radiation therapy for hereditary retinoblastoma, a malignant eye tumor, are at increased risk to develop a type of bone cancer called osteosarcoma. Similarly, people who have nevoid basal cell carcinoma syndrome, a type of skin cancer, are at high risk for development of basal cell cancers in irradiated areas.